Well, at the outset, I want to thank Celine Parek, my good friend, for putting together this marathon sessions he does once a year. And thank you, Joseph, for doing the technical and other moderating here for this part of the session. And I think Alan Yan also was a major contributor to putting these things together. So I enjoyed the last session, which actually had a few bits, about the availability of training, and that is a segue to this session. Because if we had those implants and if we have those equipment and the availability of other things which go with it, because we do know that we have technical expertise there. We have great surgeons in different parts of the world, but what hampers the care sometimes is not the availability of the implants or the equipment and so on and so forth. So this session was put together to see what can be done to kind of level the field or make the latest and greatest available to everyone in the world, be it a developing world or developed world. So we want to see what barriers are there and what difficulties we have faced. So we have an excellent panel here of both surgeons and experts from the industry. So I'm looking forward to a great session here. I want to thank our panelists here, Nicholas Ho from, I believe it's 4 o'clock early morning there. Nicholas, I know hopefully you had this coffee and ready to go, very early start for your day there. And Abhishek and Shilpa is also there with us. And I was hoping we would have Shannon Cummings, but hopefully he will join us very soon. So a brief introduction. I will start with Shilpa, Dr. Shilpa Munot. She has obtained an MBA in healthcare in the United Kingdom. She is a clinical neurotherapist and director of Munot Healthcare Foundation. She trained in India, worked in UK, United Kingdom for 12 years. So she has experience from healthcare in both India and also United Kingdom, and worked in also leading investment bank in India. Currently, she runs also a foundation which focuses on orthopedic wellness for the underserved population. And Shilpa and I have been talking about this for a long time, and you will see. And her husband also is a very well-known, internationally renowned orthopedic surgeon specializing in foot and ankle surgery. We had the pleasure of hosting him in our place here, and we talked about how we can collaborate on various platforms to bring kind of equality of availability of implants and techniques across the world, and especially in India as well, because that's where I go all the time. And Nicholas Holm is a vice president of international sales from Exactech. He has got an engineering degree and started in product development almost 20 years ago. And his expertise will be interesting because patents and how to promote a product in different parts of the world. And because he has moved to sales and management over time, and he's traveled the world, is currently based in France. And Abhishek Jain, he is a doctor and he is a consultant at Foot and Ankle Clinic, the Delhi Foot Clinic, I believe. And he is a founder. He is an innovator, and he has done a tremendous amount of work. I had the pleasure of hosting him as well in our facility, and is currently an executive committee member of the Indian Foot and Ankle Society. And he has been in faculty on numerous courses and teaches extensively in India and abroad. He's also elected international member of the American Orthopedic Foot and Ankle Society. And he is into AI and integrating AI into teaching. So we can explore those things as well. So without further ado, I want to start off with a question. So I know we have folks listening in from around the world, and you can use the chat box anytime and share your experiences as to what difficulties you face. If you say want to bring in a product and it's available in one country and not available in another country, and what difficulties you have faced. So I've been traveling to India, and so has Celine been as well. And one of the first few ankle replacements I was involved with was the small bone innovation at that time was doing the star ankle replacement in Gurgaon, and we did a total ankle replacement there in 2012, I believe, and then Celine also, and we regularly go there, and case by case basis, it is always a struggle to bring in the implants, and sometimes the implants get stuck in the customs, and we have to explain that it is for the teaching education process and so on and so forth. But over the years, me talking to folks in India and abroad, Sri Lanka and other places, there has always been a common theme. We have patients, we need the specialized implants, but we have difficulty. And I talked to the other side as well, and I talked to folks like Nicholas Hove, Shannon Cummings, and the CEO of Stryker, and so on and so forth. They also have their own hurdles, and sometimes it is not knowing each other as to what is required. So hopefully this session can raise some awareness and bring in some solutions. That's the hope for this. Right. So let me start off with Shilpa here. So Shilpa, I know you have done a lot towards this the problem, and you actually have been one of the successful persons to bring in certain things which we don't currently have in India. So why don't you start off and tell us, what the struggles were and how long you've been trying, and what you'd like us to see be done here.
So, thank you, Vinod, thank you, Celine Parikh, and thank you, Dr. Vinod Panjwavi, for having me in this discussion. This has been an ongoing saga for us, simply because my husband, orthopedic surgeon, specialist in foot and ankle, he wanted to do ankle replacements because that's something that's not being done in India. So, to get the implants was very, very tricky in the sense that there is a process that needs to be followed, and that's bureaucratic in nature. But having said that, I have been through Dr. Panchbhavi and few others to try and see if we can equip the interest of implant companies to start sort of having a setup in India for these kind of implants, because each patient that comes across, we need to do patient specific implant, get the bureaucratic approvals, the customs, as Dr. Panchbhavi said, and we do it. So one needs to understand that there is always going to be a brewing period when any new company comes into play, and have that bandwidth to have the brewing period. Sort of everything cannot be profit and loss at the very beginning. So, but please understand that ankle replacement is in its nascent stage, and if it is bought in India, the chances are it will gain traction, because we do have patients suffering from arthritis, and more so post COVID. I mean, orthopedic surgeons will agree to that. So post more COVID, we've seen a rise in arthritic patients. So I think this might be the right time, the right opportunity, the right market gap to be able to do such things. And it becomes easier for surgeons because it's a catch 22 situation. Implant is not there, so surgeons don't wish to get trained. But having said that, once we have the availability of implant, the paradigm shift of using those implants become much more viable. So that's really what our experience has been, and rather a struggle as well, which Dr. Panchbavi is party to.
Yeah, I totally agree with you there, and part of the problem is, you see, like you said, not knowing, it is, there are a lot of struggles, right? I mean, first of all, if you're not used to doing certain things, then you may not venture out to do those things, especially if things are not available to support that new direction. Because you need to have not only the surgeon but also the others trained in the system too, right? I mean, so uh, yeah, let's talk to Nicholas, so Nicholas, I know you have wide experience in sales, and you probably tried to expand the portfolio in other countries, other parts of the world. So I'm sure there are different challenges in different parts of the world. Tell us about your experiences in this field, and what would you like to see, and what your aims are. What can folks from other countries do to facilitate the product reach from your perspective?
Okay. Shilpa had some interesting comments about the current state of the market in India. And I think if you look back 20 years ago, shoulder replacement was pretty much where you guys are today with foot and ankle. And companies have decided to make investment and develop their markets to be available in India. And I think they're very happy that they did so 20 years ago. So I think the market exists, the patients are there. So there's no question that we should not be doing that. The question is about the priorities of the company, for sure, because money does come into play, unfortunately, when we look into future business development. Training, you nail on that, definitely is a big part of the question. But I would like to bring one more topic from what I've seen in India is the state of the disease that you guys have to treat is oftentimes way more advanced than what other countries have because they have availability of the product, because it's more in the habit of doing it earlier. And unfortunately, in some degree, the products that we have developed were meant to be used at an earlier stage of the disease. And so we don't necessarily have all of the bells and whistles that you need when you have 40 degrees of varus versus when a patient comes in early. Is that something that you see in the foot and ankle in India, that people wait and wait and wait until they come and see you?
Yeah, Abhishek, you see a lot of patients, and you experienced some of. I know you did fellowships in outside India in Western world, and you have a clinic of your own. Certainly, you can answer that question and see if that has an impact in you choosing products, and what can be done about that.
Yeah, so very good morning to all the panelists, Dr. Panjwari sir. So yes, in India, this is a very pertinent problem that the patients wait for long till it becomes absolutely impossible to stay with the problem, and then they seek surgical option till they can tolerate the problem. They always try to evade any intervention. They try to book themselves for conservative options, which at times work. Most of the time, they don't work. For example, a bad ankle arthritis, a bad subtalar joint, a bad bunion. You can hang on for some time, but then we are patient for many obvious reasons as per the demography of the country. Um, they wait. Money is a problem. Awareness is a problem. Now let us see how many dedicated foot and ankle surgeons are there in India. Not more than 30, 40. So for a population of 140 crore, 40 is microscopic, perhaps nanoscopic. And there are many states of India where there are no foot and ankle surgeons. So many of the complicated foot and ankle issues are not even addressed because many a times, if not all the times, the general orthopedic surgeons try to handle the situation in their own way, in the best of their capabilities. But that is not what was supposed to be done in the first hand. Patient was supposed to be referred to a specialist, to a tertiary center in a big city, and that's not done. Patient lingers around, and then when the patient, by the time the patient comes to one of the dedicated foot and ankle surgeon, by then the plan changes. Initially, my plan was salvage, a reconstructive procedure. 3 years down the lane, say arthritis has set in, and now I'm left with fusion or something which is just a salvage. So yes, what Nicholas said, that in India the patients wait, they procrastinate for many reasons. Yes, this is the reality. And about the new technology, why don't they enter the market, or as Shilpa said that there is a lot of bureaucratic hassle that we have to face. Well, I would compartmentalize the the delay or the problems in 4 categories. The first category is surgeon itself. The second category are the companies. The third category is the bureaucratic and the systemic problems that we face. And the fourth is patient itself.
Yes.
Let's talk about the surgeons. Let's talk about total ankle replacement. Is it the fact that if I don't do a total ankle replacement, the patient will be in pain? No. We have a very viable and a competitive alternative available. That is a fusion. So this allows me to buy the time and sit in my recliner, do the procedure, and I would not want to take the hassles. You would remember, Panchvavi sir, that we had a lot of discussions when I came back from US, and I did a lot of back and forth in understanding how can we get it. And then what happened? I got tired. I had my own busy schedule, and I had my own patients, and I knew and I knew ankle fusion surgery. Getting all this in one place, I said, chuck it.
Yeah.
Let me get back to my business. Right?
Can I stop you before you go to the next one and bring in Nicholas here? This is actually the real thing. You know, people, doctors, I know there are not many foot and ankle kind of specialist doctors, but India is a big country. And those established foot and ankle doctors, they really have certain elite patients or certain demanding patients or certain, patients who will benefit. Say, I mean, we're talking about total ankle example, then we can move on to the other implants as well. They don't have that ability, but like Abhishek correctly said, it is a big hassle. I mean, he tried, and Shilpa actually got through that, and we'll go to Shilpa next. But he is right actually. So the four parts, Abhishek, you laid down very well. Those challenges, compartments of challenges, a doctor itself. Yeah, how much the doctor. I mean, obviously because they all are busy in their own practices, they will say, okay, I can't call this guy, that guy, or the implant, because you can't just get one size. You have to get a size above, size below, whatever it is, or equipment and instrumentation, and so many things. I remember the case which I did in Gurgaon. Her That particular patient was a mother of two well-known doctors there, and we flew in this equipment set from USA, and the patient is anesthetized and everything, and we have two big screens in the OR, and then one screen is relaying the surgery, live surgery, to the auditorium. And in the auditorium, I recall Tom Lee and other Sunil Dharan folks were there, and they're trying to say, what incision we're doing, so on and so forth, because penicillin is anesthetized and draped and ready to go. And somebody whispered into my ear, "Oh, doc, they have all the saw blades, but they don't have the attachment to put the saw blade in function." I'm panicking. I'm not able to listen to the next question because what is going to go? And a patient size, and then they said there's some team's going to go to some other hospital and bring in the appropriate set. So we can plan these things, but there's so many struggles at every level of the game in the game here. So yeah, we can go back to. So those are the surgeon real issues. How long can they keep fighting for this to happen? I know you have some comment, Shilpa, there.
Yeah. Can I complete by what are the
Yes, 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 yes. But that's a very good layout you have there, Abhishek. So I just wanted to make sure that we address each one as we go. And
So we just got aware of like what are the surgeon's problem. I can do something without getting the hassle of getting a new technology. So let's go. The second problem, the second category where the problem is there is the companies, the big companies like the Stryker, Zimmer, Smith Nephew, J&J work. It is not, I'm not ready to buy this that if they want to penetrate Indian market, they cannot. But it revolves all around the money and the revenue. Second, penetrating a market will draw a lot of tax and financial liability. Then they will calculate how many surgeons will do it. and then they have to figure out the cost is to benefit ratio, and taking everything into account, they they would like to be on a recliner at the fourth row. They would not like to penetrate the market, because we, the demanding guys, are not in numbers. And perhaps because of the policies by the central regulatory system or whatever, the implant cannot, the implant costs are capped. So, and all these MNCs have to have their revenue share and to get the ROI.
You
So
certainly
here,
have, sir,
yeah,
sorry, Abhishek, to interrupt, but you certainly have great points there. Just want to bring in Nicholas here. So, Nicholas, you gave a great example when you said, the shoulder was there 20 years ago where the
Yep.
foot and ankle is. Do you see a parallel here? How do you think, the shoulder probably face the same problem which Abhishek is saying now? You see, I mean, all these things, shoulder, I mean, knees and hips are very common, right, Abhishek, there? I mean,
yeah, yeah.
why
Oh, hips
is,
and knees are like, they are like potatoes and vegetables. They sell like
yes.
in the open market.
So how did the shoulder market? I know exact. I mean, Nicholas worked with Exactech, and Exactech is there in India, right? I mean, for shoulder, I
We
believe.
no longer.
Oh, no longer. Oh,
No, and I can tell you about that. But because
yes, please.
Abhishek is
Go ahead.
totally
Yes.
right, it's ever since the prices were capped by the government that made a huge, huge issue for some companies. I mean, we are a relatively small company. We don't have the volumes of the big five that you cited, Abhishek, and it makes it increasingly difficult for us to justify being in India specifically, for example. So you're totally right. We have a pretty heavy investment at the beginning in regulatory, in launching the product, teaching the surgeons, and so on. And we need to see a return on that investment. Totally agree with you. That doesn't mean that needs to be done on year one, right? And that's a bet in the future. And to your point, there's 1.5 billion Indian people today. I'm pretty sure we can find for the next 20 years patients that we can take care of, right? Shilpa, I'm sorry, you want to weigh in?
No, I hope you've finished putting your point across, because I totally agree with Nicholas. Please understand, for example, foot and ankle is in its nascent stage as knees were in 1990s. But now look at the shift now, as Abhishek mentioned, probably every hospital, every clinic does knees. So I think there is some lesson to be had from there. There is always, as I mentioned, going to be a brewing period which may not look very attractive ROI. But having said that, if you look in the long term perspective, simply because of volumes of scale, please understand India is a huge country, though we may have very small number of foot and ankle surgeons. But these foot and ankle, 30, 40 foot and ankle surgeons are now training other people to become foot and ankle surgeons. So that is one. Like currently, Dr. Manoj runs 2.5 year waiting list for having fellows to be trained in foot and ankle surgery. So I think there is a growing interest in foot and ankle. Secondly, even if we have limited number of surgeons and limited paying capacity, because it's a price sensitive market, so you don't expect every tier 2 and tier 3 opting for this surgery. But even the metros and the tier 1s plan to take on this, then the chances are you're getting volumes of scale. It will increase. There is no other way forward. That's what my presumption is. And of course, most of the surgeons now, if you see, I mean, Dr. Vinod Panjbavi and Dr. Salain Parekh would agree to it. There are a lot of young Indian orthopedic surgeons trying to come abroad and learn the new technologies, the new implants, and so on and so forth. So there is always a hunger and a drive in India to be able to do something new. I really, I mean, this is my view. I stand corrected, and I might upset some of them, but my view is that till it is not available, to judge whether it's going to be used or not is very speculative. That's what I think. Because when computers came, it needed a lot of paradigm shift, but now it's become your part and parcel of your life. Similarly, I just think ease of availability, and yes, the bureaucratic difficulties are simply because we are implanting one implant for per patient. But if the manufacturing unit, or if the availability is much more in India, whatever distributor network or whichever you say, it'll the bureaucracy will reduce drastically. So initially, yes, once you register the implant, then the availability use becomes easier. So, coming on the 4 points that Dr. Abhishek said, skill development for doctors, which is happening in its own way, though in a very sort of mom and pop shop kind of sector, not a very organized one, but people are doing because they want, the hunger is there, the need is there, and they think they need to do something different to stand out. That's one. Coming to bureaucracy, once any implant is registered, and if the company can make it available, then the hassle becomes much lesser, much easier. As far as patient is concerned, if the implant is available, education and awareness of patients becomes much easier. So I run a foundation where we do a lot of charity surgeries in tier 3 and rural areas of India, and I predominantly see that there is so many cases that would benefit much more with ankle replacement, because a, they are younger. I mean, orthopedic surgeon knows the indication more than I do, but a, they are younger, b, they are productive part of the society, so they, instead of fusion, they would benefit more from ankle replacement. And there are a lot of there is a lot of money to be had, in terms that there are a lot of people who are ready to donate these implants for these charity surgeries to happen. So my concern is that, yes, once we have the implant, creating awareness and proof in the pudding, in those, if we try and see that if we do it for a lot of patients and they see the benefits, the awareness starts, word of mouth is one of the other main channels in India to market. So I guess that would take part, that would be easier. And that's really, I think there is merit in trying to consider setting in new technologies in India, because I think even if limited people do it and limited patients access it, volumes of scale justify the need. And of course, with the mindset that ROI is a long-term gain to be had, and not something that can be justified in a short term. So that's really my, I stand corrected, but that's really what my view is about this whole aspect, because we've struggled with a lot of patients who want to do it, but lack of implant is something that causes a lot of issues. My husband Pradeep Munot has just joined us, but yeah, that's really
Yeah,
what.
Pradeep, if you have anything to add, go ahead. We,
Um, I,
you guys,
I was,
both of you guys, obviously were successful in introducing an implant there. So, Nicholas mentions the cost is a big issue. If the company doesn't make, and obviously it boils down to it's a profit organization, so they have to make profit, right? So, I don't know if Nicholas can weigh in on that. So. Obviously there's a cost to manufacture something and cost to market, and then obviously the ultimate price is there. But is there a bigger margin you to have in certain parts of the world, or can the margins be different in certain parts of the world, or could the manufacturing be certain in certain place? And because Pradeep and Shilpa would tell you that there are companies who are able to do things and they are doing things. So how can we make in the middle, or how can other companies jump on this bandwagon?
no, I think I think I was listening to the discussion earlier part, and Shilpa mentioned, and everybody was talking about ankle replacement, and I think Abhishek also mentioned about ankle replacement. And yes, people can go with the fusion and still live a normal, almost normal life. But it's just not about ankle replacement. The
Yes.
other technologies available around the foot and ankle surgeons in the world, which is not available to India. Means I've been doing last 10 years in India. Initially, to just get a normal 2.7 foot and ankle plate was a big challenge in India. We would either use a 3.5 recon or a max fax plates of 2 which the maxillofacial surgeons had it. But now you look at it, how many Indian homegrown companies in foot and ankle are there? And they are thriving. They are getting, means of all the businesses, trauma, spine, joints, shoulders, the maximum return on growth, ROI, is in foot and ankle. They are seeing growth more than 30 to 40%, which is humongous. Now, initially, that's why Synthes stroke debut joined in and started introducing the implants, and they really recognized that, hang on, they had two sets and they were just not available. So if I had to use a Synthes set, I had to book in 2 weeks in advance. And if I had a trauma and I had to do it tomorrow, it may not be available. To an extent now, Arthrex has sets everywhere in India, almost every big cities, at least metro cities, they have made it available, and they're still feeling short. Synthesis is feeling short. So coming back to just not total ankle, we have a lot of other implants. As Shilpa and Abhishek mentioned, it if there is education for foot and ankle, if there is education of even general orthopedic surgeon that these are the implants which have to be used or can be used and has a benefit, then the volume is humongous, you know. And the other thing is, in today's world, and I think both Vinod, Abhishek will agree with that, most of the implants are 19-20% almost similar. It's the instrumentation and service which matters.
Agreed.
If you have good instrumentation, which no offense, a lot of Indian companies lack, or they have started investing, few Indian companies have started investing in good instrumentation, it makes the life of the surgeon much easier. For me today, if I or my patient has to pay 1.5x more for an implant because I get a better instrumentation, I would be more than happy to do it because it makes my life easier as a surgeon. That means my stress levels are low, my productivity increases,
Outcome.
and outcomes of course increases. I do not need to do three times a hole for locking and find that the locking screw does not, you know, it makes it much more easier. So long story short, ankle replacement, yes, but it's a small pie. But the other cases, the trauma cases, the elective foot and ankle cases is humongous. The number of flat foot cases which I was doing 8 years back to 10 years back to now, significantly volume, and means it will increase the number of types of anchors and the suture materials and the fiber tags of the worlds which we are doing it significantly increased. I mean, my volume would have increased 10x. That is what we are looking at. So, yes, initially bureaucracy does play a part, but the better part is once you clear that registration, there is nobody to bother you. You know, yes, it is the initial hassle of 1-2 years. Nobody's sitting on your head. Tell me what happened to 1 year follow up, 2 year follow up. Then everything slides in. The other part which I heard about Exactech, see, Synthes had an Arthrex in a second way, had got into India because they had the company presence in India. The problem with other companies are even their joints and other stuff, it is through a distributor. For a distributor, there is no big incentive to produce to get a new implants because it is a lot of hard work for them. Only if it comes a push from US or France or from Western side, no, we want to. This is our vision for next 5 years for India. Initially 2 years, there will be no gains. But hang on, getting on, tell the distributor, we will compensate you, we will look after you. Then there will be a better role, better coordination between companies or CEO or the CFOs of the likes of Striker and other places to the Indian Cup. I mean, otherwise, that is a bigger issue here.
And I just have, sorry, just to add, Nicholas, to add two more points, Dr. Panchpavi, is one is there is always going to be a gestational period, which is in any business, I guess. But also, what you need to really look at is that something that's available I mean, globally, it's unfair just based on ROI returns to make a decision. I know you guys are into business, but just to make a decision based on ROI that whether these implants should be available in India or not, I think that is something that a company and an organization needs to really look at. That is one. Two, there is business to be had, as Dr. Manoj said. And third, I think government is supporting, like now, a lot of manufacturing happens in India. As you might be well aware, it's one of the leading manufacturing sort of economies of the world. So if the cost of production can be reduced, that's something that the companies want to consider manufacturing right in India. So this is just something to ponder over as companies would want to.
Absolutely, yes. Abhishek, you have a point there.
So all these companies which are stationed and based outside India, they actually need to understand only one mantra that is going to take care of their everything, is that you are be ready to cater to a population of 140 crores. Be ready to bank on the volume of the patient. Incubation period will be there. But if they understand this, that if they are playing on volumes, then all these ROIs and latency and the incubation period will start looking small. And for that, they need to come inside India and train the specialists so that they can get more and more patients to use their implants. That's what everybody has been doing. Every company has been doing in knees and hips. Get new technology, train who have already been doing this job, who under which fellowships will be there and more people will be trained. So definitely we are looking at an incubation period of 1 decade, and then ankle will become hip and knee. That, I think that's the only way to go. We will have to wait. The companies will have to wait for some time to reap their benefits.
That's good. So, Nicholas, we started off talking about ankle, and rightly said, there are lots of other things, not just implants, but also, like, for example, the guides and so on and so forth, the bunion guides and things like that, or equipment like the consoles for driving those burrs, Shannon burrs, have been very common these days. Um, uh, Not just India, but anywhere else also in the world. How are you? Are you? I know you said you have a room to grow, right? I mean, you said there are other big five, but Exactech is also a big company. But and I'm sure you are looking for markets everywhere in the world as well to grow. Do you see any barriers? I know you pulled out the shoulder from India, but are there in other areas where you see growth in India and other parts of the world?
So the cost is definitely number one, right? And I totally respect what Shilpa said, that yes, there are amazing manufacturers in India. That's one way to reduce your cost, is to get your products manufactured in the country. The issue is that nowadays the regulatory aspect is more often tied to where you manufacture your product. And so for me to just simply change the manufacturing from in the US to India, it takes a whole re-registration of the product from scratch in all of the rest of the countries if I want to benefit from that. So it's the legal aspect and the regulatory aspect makes it increasingly difficult for us to change anything in the product. And that's a big hurdle for us to enter into those emerging markets. I totally agree on the volume, and it's been amazing, my experience in India, where we believe that our Western surgeons are busy. They should go to India to understand what a busy surgeon is, because you guys do way more cases than what we do in the Western world. And so that also ties into how much we need to put in, because when you line up 10 cases a day, you pretty much would like to have 10 instrumentations ready. And so the amount of money that is sitting in the instrumentation, the level of implants that we need to have ready for you to use is huge as well. And so, yes, there is the incubation period. Yes, the sun will be shining 10 years from now, but it's at this minute, everybody's hesitating because they see the difficulty to get started, right?
So Abhishek, you had these four little compartments. Are we going to go? Shall we go back to the
Yeah.
next in your list?
Yeah. So we talked about the patient, we talked about the bureaucracy and system. Now, in bureaucracy and system, we have three players. One is the custom, one is the bureaucracy, and the third is the insurance. The insurance guys will have to recognize any new surgery that is brewed out of new technology and which requires a new implant, which further requires a new investment, which further requires new skill training. Now, if everything is in its place and if insurance guys are not recognizing it, then who is going to pay, say, 3 lakh Indian national rupees for an implant? I remember the first day where I was in OT with you, you had shown me a TTC nail with nitinol wire, that
Yeah.
nitinol technology. Okay?
Yes. Yes.
Imagine how much that would be costing. Arthrex is getting that implant in India, has been trying to get that implant for last 1 year. And a target maximum retail price for that implant is 2.5 lakh rupees. Without insurance, it's a no show, not a single case. Very difficult. So if these guys are not recognizing the new technology, new implant, then the company, the bureaucracy, the custom, the education, the surgeon, everything, everybody fails. And then the shout out is, in last 1 year, how many cases of this technology was done? Maybe 10. So that leads to another failure. And the last contributor of why we are not using new technology or why we are not able to use new technology is the patient itself. Out of say 100 ankle arthritis that I see in say 1 year or 2 year or whatever period, hardly one or two very hesitatingly are inquisitive about ankle replacement and ask me, would you like to do that? I would like to have my ankle moving. Now this is the level of say, awareness in tier 2 tier 3 city, or even in a city like Delhi. People are now getting to know about ankle replacement, but when they see that what are the hurdles, that if some patient asks me, would you like to get an would you like to do ankle replacement, and then I tell him that okay, it'll take another 30 days or 15 days for the implant to come. You'll have to deposit 10 lakh rupees first to get this thing done. I will have to have a assistant or a co-surgeon to to get along with me in OT. And then these are the problems, because we are not seasoned ankle replacement surgeons. It's not that we have great numbers. Then he takes a backseat. So there are issues. So all these issues will be sorted only once the implants start flowing in. In case of those technology which are not plasty related, say a new jig for bunion correction, Shannon burrs, all these problems are less, because the amount is less, and we already know how to do these things. It's all about the new technology. One or two or three cases, and there you go, you have hands on this. But as far as the plasty ankle replacement is concerned, um, Dr. Manoj has done quite a few. So he has less of hurdles and more of confidence in talking to patients, but not all of us. So the companies will have to flow in and then handhold the orthopedic surgeons, and then the way would be created as we go further. We cannot take out the car hoping that when all the lights would be green, then we'll take out the car.
Chicken or the egg, chicken, which
Yeah,
comes first, huh?
yeah.
So tell us, Shilpa and Pradeep, you guys, were successful in getting, this thing started in Mumbai, and it's about 2 years now or 3 years. Can you share with Nicholas and others, so how did you manage to, get things done? Whereas some parts of India and other parts of the world where who don't have that, they are probably still struggling.
Uh, no, so I think I will just mention to Abhishek on the insurance part, and then Shilpa will talk on that how she managed to get that whole um, H3 ankle replacement done almost 3 years back. No, but Abhishek, you're right. Absolutely, that a lot of our patients. So we have a big dichotomy actually, and I think I'm sure you will also see in your practice. I see in a lot of my practice as well. Because of our population, there are of course big numbers which come through insurance, and whatever covers through insurance, they would get it done. And I think the same thing is in US as well, and western part. You have somebody wants to do a procedure and add a BMAC. Some insurance cover it, some people
Yeah.
don't cover it.
Yeah.
They call it a pocket expense, and some people are happy to pay and some people are not. And the
Yes.
same thing I think you and me would probably see in my practice. There's some people who's I say this is the cost of the implant, or this is the cost of the surgery. Usually all the insurance people don't mind covering the surgeon's fee and the implant fees. That's what I've seen. If in see, the insurance works different. In western side, there is never a limit to the insurance what you have. You're covered. It may be 100,000, 200,000, 250. India, it's different. India, it is somebody has a cover of 500,000, somebody has a cover of only 200,000, somebody has a cover of say 1 million. So you have to set your surgery according to what their insurance covers.
No,
The
even if the
good
cover is there, the insurance replies, revise your
Yeah,
budget.
yeah. So that's a different part.
Yeah.
That's getting a little bit into nitty gritty, but we'll just ignore for that. The problem, not problem, but the what we have found is the insurance will say, as you said, revise your code. But what we have found always is they never they pay for the whole implant. So you could be getting, a surgeon would be getting the whole surgeries 5% or 10%. But if the implant costs, say 50% also of the whole surgery, they will pay for the implant.
Yeah.
Okay, that I think nobody disagrees. Is if your total insurance covers into that. Say a patient has a 500,000 rupees insurance. He goes in a sharing room. The bill comes to 250,000, where the surgeon's charges are minimal, but the implant cost was 250,000. The insurance will pay for it. That is what I'm trying to say. So that
Can
is,
I?
in a way, good news for the implant companies, and that's what we've been telling you guys. Get the implants. There is a margin for it. There is a usage for it. There are surgeons who don't mind using it as long as the patients benefit and their life is made much more easier. To have a bunion done means, I do MIS bunions now. But if somebody was doing an open bunion who is doing in the starting of their career, and if you have a nice jig and the jig cost is included in your implants, he'll be more than happy to use and gets a reproducible results, of course.
Hold your
He'll be,
thought for a minute.
yes,
Sorry to interrupt, because we have Tom Loring from Innovis. He's
Hey,
a
everybody.
very senior guy with Innovis. I've known Tom from a long time. Great engineer. He's developed instrumental in developing Total Ankle and other products for Innovis. He's standing in for Shannon Cummings, who was supposed to be there. And thank you, Tom, for taking your time.
Sure,
We have about,
absolutely.
less than about 13 minutes or so. We have Nicholas Holt from Exactech. You probably guys know each other or not, I don't know. But we have Dr. Munut, who visited us here a long time ago, and Dr. Abhishek Jain and Shilpa Munut. So we were talking about all the challenges we have. I know you and I talked a lot about how we can get those implants, and whether it's total ankle or other stuff in India, because it's a growing market. India is a growing, fastest growing economy, land of contrast. Sometimes a lot of folks are willing to pay out of pocket. That's what I feel, and that's what some of the folks who practice foot and ankle surgeons relay that to me, and so that's what we're talking about right now.
Yeah.
So, yeah, I mean, I think we have limited time, so I just want you to have your share with us your experiences as to what are the challenges you face when you try to introduce technology outside of USA, or any hurdles you think we need to look into, or anything you want to know from the folks. Currently we have 2 or 3 folks from India, and there might be some.
Yeah, I think some of the challenges that we faced when I worked originally for Small Bone Innovation, and we brought an ankle into the States and bought the global rights to it. It was the only ankle available in China at the time, and we had to change the name that was laser marked on the part. So everything stayed the same. The blueprints are all the same. All the specifications are the same. And we just needed to change the name from the former company to Small Bone Innovation. And doing that triggered within China's regulations. This was a brand new product starting from scratch. And they wanted us to go back all the way to do animal studies on a titanium plasma spray that's available for every implant at the time. And so we went from being the only ankle on the market in China to going back to, it would have been about a 3-year process and millions of dollars to get it approved again. And as a small company, we just didn't have the resources. So I guess that's an example on, depending on the market, it doesn't happen everywhere, but it's not just an easy decision of, do we want to sell in this market? There are so many things that go behind that as well, including, do you have the infrastructure? Once you get everything else done and regulatory wise, you get approval, there's still that final piece. Do we actually have the support network for a sales organization in the country? So, and
Yeah.
it's been one of our questions going into the Indian market. I know we've done some live surgeries over there with the ankle that we have, and still, no matter how hard I want to do that, I still need the sales support network so that I know there's going to be somebody there to receive the parts and to support the local surgeons and that sort of thing. So,
And before you came in, I interrupted Pradeep. Carry on with your thoughts. And I think Shilpa, you wanted to share your experiences, how you were able to get the implants which were not available, and now it's a regular thing. Can you share that with us, please,
I think
both of you?
I think yes, Tom is completely right. You need the whole setup, the whole sales team, and everything. But somewhere we have to start. Okay, so as of now, I'll tell you how H3 and we have been doing that, and I think that's been around for now 3 years. We have done more than 10. And what happens is, yes, you start your registering process, but at the same time, what you would be doing is importing per patient. Okay, so the Indian government allows you to get an import for a particular patient, and so you get the set and you get a complete set of your implants.
Patient specific.
Patient specific implant. Patient specific imports you get,
Yeah.
and that is an easy process. So we have, and that's what we did when we did the ankle replacement. We had the distributors lined up here, and then who have reasonable contacts within the bureaucracy in terms of getting it channelized, getting it through the customs, through the approval process, and then you gradually start building on those implants and your surgeon community who are now starting to do it or ready to it. And as Abhishek said, initially everybody needs hand holding. I was quite fortunate enough that Prof. Hinterman was with us for twice in Mumbai, and who hand holded me for ankle replacements. And then as numbers go by, you are doing more and more, and then you hand over to other surgeons as well. But there is that is learning would be there, and I think the same thing applies to US as well. I know in UK, a lot of ankle replacements are done by two foot and ankle surgeons. They don't allow a single foot and ankle to do it. So that is going to happen now. That I think the challenges would be the same everywhere in the world. I know the fact that China has a 3 year waiting period to get an approval, irrespective of the changes of your mark or not. When you submit, Brazil, when I was with Vinod in US and other surgeons in Baltimore as well, I was talking to a lot of company people. That's a 2 year, 3 year waiting period, and people are still going. Companies are still going and registering it. So why? It's in India. It's usually months to 1 year. That's the waiting period. But once you're in, like today, Centis Depot, Arthrex, they're in, so they can get any products, all the products which US has it. Almost within 6 months, they are launched in India.
And as far as ecosystem is, Tom was mentioning, IEs, the distributing network and other things. I think partnerships are quite sort of name of the industry, as well as other innovative business models that can be had. So that's something that needs to be worked out. And I'm sure it doesn't cost millions of dollars to do that, at least in India, because as I said, price sensitivity is there. So I guess that's one of the reasons I don't see that. When we did it, we also, while these patient-specific imports were happening for our patient implants, H3 total ankle replacements, we made sure that as a backup, we have one of the distributors and one of the manufacturers, because manufacturers can be used as a third party. Sorry, Nicholas, I'm shifting the thing over here. But manufacturing, you don't really need to set up your own unit. You can use other manufacturers as your third party importers. So that all those things we looked at. I think the whole crux of the thing is the willingness, the drive to see if it happens or not. I mean, just kind of not getting on to the ground and kind of we need to not have a very myopic vision of this. There are ways and means to crack into this market, to penetrate this market, because there is a market gap that needs to be looked at. So
another example I'll tell you of leave up and ankle replacement. The MIS work has increased so much in the last 3 to 6 months in India that Arthrex cannot keep up with the supply of burrs in India.
See, I mean, you're right. So, Deep, you're right. You see, so I think, and both of you made a great point. Somebody has to start, and there is already, people there in India. So they have been successful. Synthes, Arthrex, so there is room for more. This is what I get from, so somebody should start somewhere. I think we have just about 4 minutes here. I just want to make sure that everybody gets in their final word and wrap this session up. It's been very exciting. I think we just scratched the surface, but at least we opened up the thought process, and hopefully, folks can get interested in the huge industry outside of limited spaces in the world. This is available, and encourage the CEOs or the leaders to look outside their own comfort zone and make some inroads in places in the world wherein these implants and latest and the greatest equipment is not available to help everybody in the world. Right. So final word, Abhishek, in 1 minute.
So this message to all the CEOs of those companies who have yet to come to India, ask them who are already here. They are making huge profits. So wait for some time, and we are here to make sure that you will make huge profits. And our people get benefited by your new innovations and technology. We are here to welcome you.
Nicholas, what have you learned so far? What can we do for you, or what can you do for us or everywhere else in the world?
No, very nice. I mean, it's been a great session, great exchanges. Thank you very much. We will try to see what we can do. I know that the Indian market is huge and there's a lot of opportunities to come. And I definitely know that the Indian surgeon skills are there. So I'm not worried about that part.
Shilpa and Manut.
I would just like to conclude saying that foot and ankle is what knees were in the 90s. And now you can see within a couple of three decades where we are with knees and with other implants. So that though foot and ankle is a very small sort of niche area, but having said that, there is a lot of potential in that. So that's something food for thought for people who really are sort of on the borderline of whether they want to venture into India or not. Secondly, there are ways and means of coming around things. We just need to really brainstorm it in a different perspective and have somebody on board who is on ground when these discussions are, so that they can give you a real picture of what are the ways and means to get things going. And third, I mean, this is a very sort of philosophical or call that implants that are available pan India, pan globally. I mean, implants that are available globally, India should not be deprived just based on long-term ROIs. That's really, because I think there is a return on investment. There's no two ways about it. It's just the gestational period that may vary in other countries vis-a-vis in India. So that should not really be the make and break decision. And just a concluding note, India has the second largest number of billionaires in the world. So
That's true. Anything from your end? Anything to add?
No, I think Shilpa has mentioned everything. I don't want to add anything more on that. As a surgeon, I would really want what you have in your OR, other than your initial invention. I think why should we deprive? And I tell you again a story. When I was with you, we saw the convent brace. I think you were using BioBrace, and within
Yes.
2 weeks it was available in India. And somebody was using for shoulder. It's 350,000 rupees, but the shoulder surgeon using left, right, center. So we
Yeah.
talk of the cost. There is a population, and I think metros. I have reasonable number of patients. Is money is not an issue, insurance is not an issue. I want the best, and that's a decent chunk. So why deprive of them? So somebody wants to come to get US to do the surgery, and then pay Vinod, or they can pay me and get it done here.
Cheaper. Tom, what's your take?
Yeah, this is, I mean, these are hard challenges. And I think depending on the size of the company that's trying to make the decision, sometimes for a very small company, it's easy because there's one person in charge. In a very large company, they may have endless resources and can do something very easily. And I really think it's the mid-sized companies and where you really need to get somebody at the very most senior level committed to it. Trying to bring it up. I mean, Vinod and I have been talking about this for years. We've supported live surgeries in India for years, and getting the rest of the company behind you to commit to it. And it's hard. Sometimes it's hard to get people to stick out their necks. But
Perfect. Thank you. Really, I need to wrap up this session. I want to thank all the panelists Ram, Pradeep, Shilpa, Abhishek, and Nicholas. I know it must be go back to bedtime. Hopefully, you'll get some sleep, or maybe not. But I really want to thank Convet for sponsoring this session, and Celine Parekh for the opportunity. Joseph, thank you again for the patience. You all have the rest of the evening or day. You start.
Thank you.
Thank you
Thanks
very
a lot.
much.
Goodbye.
Thank you very much.
Bye-bye.
Thanks, everyone.